How to inject Follistim AQ Cartridge, presented by Fuze Health. Follistim AQ Cartridge comes in 3 sizes: 300 IUs, 600 IUs, and 900 IUs. The cartridge is a glass vial that contains pre-mixed medication and will be inserted into the reusable Follistim pen for injection. The Follistim pen is a reusable plastic device made up of 3 components: a cap, the cartridge holder, and the pen body, which has a dosage window, dosage marker, and a dosage knob. How to store your medication. The cartridge is stored in the refrigerator before the first use. Once it is punctured for the first time, it can be stored in the refrigerator or at room temperature for up to 28 days. If refrigerated, you can let the medication sit at room temperature for about 30 minutes before your injection to allow it to warm up and reduce injection discomfort. Supplies needed. You'll need 1 reusable Follistim pen, 1 Follistim AQ cartridge, 1 new pen needle, alcohol swabs, sharps container, gauze or tissue optional. Examining your medication. Before starting, wash hands thoroughly, work on a clean surface, and inspect your cartridge. The liquid inside should be clear and colorless. Do not use if damaged or cloudy. Prepare the medication. Pull off the pen cap, unscrew the pen body from the cartridge holder, and put everything aside. Wipe your cartridge seal with alcohol and insert it into the cartridge holder, metal-rimmed end first. Screw the pen body onto the cartridge holder, pushing the long rod against the cartridge. Make sure it is screwed on securely. The arrow on the cartridge holder should point to the center of the alignment mark on the pen body. Clean the cartridge tip with alcohol. Get a new pen needle, remove the paper seal, and push it straight onto the cartridge holder and screw it on tightly. Pull off the outer needle shield and set it aside. You will use this later to remove the needle. Pull off the inner needle shield and discard it in the sharps container. Prime the pen. Perform before first use of each new cartridge. Hold the pen with the needle pointing upwards. Tap the cartridge so air bubbles rise to the top. Turn the dosage knob counterclockwise until you hear 1 click. With the needle still pointing up, push the injection button as far as it will go. You should see a small droplet of liquid at the needle tip. If you don't see a droplet, repeat this step until you see a droplet. Priming is important to ensure you get the correct dose. Once you have primed your pen, you are ready to dial to your dose. Set your dose. Turn the dosage knob counterclockwise to your prescribed dose. The dose should be aligned with the dosage markers on the window. If you dialed past your dose, do not turn the knob backwards. Continue turning counterclockwise past the 450 IUs mark as far as it will go. Then push the injection button back in to reset the window to 0. Now you can redial to your prescribed dose again. How to do a subcutaneous injection. The abdomen is the most common area for a subcutaneous injection, but always check with your provider to ensure you are injecting at the right location. You should inject at or below the level of the belly button, roughly 1 to 2 inches away from the navel. Avoid injecting directly below the navel, because that area is very vascular and can lead to more bruising. Always rotate your injection sites to decrease discomfort. You are now ready for your subcutaneous injection. Clean the injection site with alcohol. Grip the Follistim pen in the palm of your hands, leaving your thumb free to press on the dosage knob. Gently grasp a 2-inch fold of skin at the injection site. Insert the entire length of the needle in one swift motion at a 90-degree angle and press down on the dosage knob as far as it will go. Slowly count to 5. 1, 2, 3, 4, 5. Release the pinched skin. Pull the needle out and release the dosage knob. Do not release the dosage knob until you have pulled the needle out to prevent any backflow of fluid or blood into the cartridge. Apply light pressure if needed. Bleeding, bruising, or redness at the injection site is common. If the dosage window reads 0 after your injection, you received your full dose. Recap the pen needle with the outer needle shield you set aside earlier. Twist the needle shield to remove the used pen needle and discard it into the sharps container. If there is still medication in the cartridge, recap the pen and store it properly for your next dose. If the cartridge is empty, disassemble the pen, remove the empty cartridge, and discard it in the sharps container. Reassemble the Follistim pen until you are ready for your next injection. Dosage window does not read 0. If the dosage window does not read 0 after your injection, you did not receive your full dose because the cartridge ran out of medication. The number shown in the window is the full amount of medication you need to inject with a new cartridge to complete your dose. For example, if the dosage window shows 50 IUs, you need to inject 50 IUs more with a new cartridge to complete your dose. To do this, disassemble the Follistim pen and discard the empty cartridge and used pen needle in the sharps container. Reassemble your Follistim pen with a new cartridge and a new pen needle. Dial the dosage knob to your remaining dose, for example, 50 IUs, and inject at a new injection site. Once you have completed this second injection, remove and discard the used pen needle. Recap your Follistim pen with cartridge inside and store it appropriately for your next dose. Great job! You have completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.